Hey there, my name is Dr. Alicia Davis with Davis Family Chiropractic, and I want to talk to you a little bit today about sensory issues, ADHD, anxiety, and the role chiropractic care can play to help your child. Parents, I have been in your shoes and have had a child diagnosed with sensory processing disorder as well when they were younger, and he has done incredible with chiropractic care, OT, and really has improved so much that we don't even have that diagnosis anymore. So I've been in your shoes. I know how frustrating it is. I know what it's like. It's challenging. It's tough. And you may be thinking, what in the world does a chiropractor know about how to help my child? There are so many labels that your child may be given, and it's hard to ignore that label when you know that your child is struggling or having a really hard time, not only with school but also social settings and behavioral setting, and those challenges can be really tough for them to navigate on a day-to-day basis. So this is what we're going to talk about today. And so in our office, we measure and we test how well your child's nervous system is functioning with the Insight scan. And so we're going to talk about that a little bit later and how that works and how we get great results to see exactly what's happening with your child. But chiropractic care revolves around finding that balance with your child and allowing your child's nervous system to function at its best. Really, what does that mean? Everything in our body is controlled by our nervous system. The way that we walk, the way that we eat, the way that we, how well we sleep, really how our brain and our body communicate, all of that is controlled by our nervous system. So if you have any stress, if you have misalignments, if you have subluxations in your child's spine, then that nervous system is not functioning as best as it can. It's really impacting the way that they perceive the world and then how they also can respond to that. It can impact how they process that information that's coming in, even how they learn as well. So have you heard that expression, my child is stuck in fight or flight? Like, what does that mean? These kids are stuck in a sympathetic dominance. It means that their nervous system is so overstimulated. They've got all this stuff coming in at them from all different angles, from sight, from sound, from smell. All these things are being taken in through their brain and through their body, and they're really not able to regulate that. They're not able to control how they respond back to all that stimuli. And so these kids' brains are really struggling with day-to-day, how they're able to function on a day-to-day basis and how they're navigating their day. There's really what we call kind of that disconnect between the brain and the body, and the best way to improve that is through chiropractic care because it's going to directly impact how well their nervous system can respond and adapt. So parents often ask, okay, so my child's been given this diagnosis, but nobody really can tell me why or how they can help. So let's talk about the different ways your child can become overwhelmed or stuck in that fight or flight mode. And it really comes from different types of traumas. And there are 3 different types. We're going to talk about all of those. The first one is physical. And I think for parents, this is really that easiest to understand. It may be a fall that they've had. It may be that they're super active in sports. They may have had an injury with that. It can really even be posture related with how much our kids are on cell phones or other electronic devices, iPads, hunched over playing video games. All of that can really take a toll on how their spine is growing and developing. Not only being on video games, but then we also get that lack of activity, and that is just as damaging to their spine and their nervous system because their body's not moving. Our bodies are designed to move. It allows our brain to process that information better. So really getting your kids active, getting them out there and doing things can really help as well decrease those physical stressors on their body. Chemical. So when we look at chemical, most of these kiddos are falling kind of in that preteen, teen age distribution, and their bodies are going through a ton of hormonal changes. I have 2 teens myself, so I can relate to that. Not only do we have all those hormonal changes, but we also have the food that we eat is full of toxins. There's toxins in the environment. I know it's so hard with busy schedules to sit down and cook that nice healthy home-cooked meal at home. But when we're on the go and we're grabbing stuff, it isn't the best quality of food that we can fuel our bodies with. So that's something that we also want to try to talk about. And then emotional. Like I mentioned, I have 2 teens. And what we look at with that emotional component is really, really huge for me, I do feel like this is kind of personally, where my child developed that emotional struggle from with the sensory processing. Is my mom was very sick when I was pregnant with my first. She passed between my first and second, and for me that was a huge emotional turmoil. And so I was under a lot of stress and a lot of loss during both of my pregnancies. And so I do feel like that was really one of the emotional stressors for my son. Social media plays into this so huge. Kids are on their phone, they're looking at the snap, they see, Susie's got on this cute outfit, I don't have that outfit. So-and-so's got this great car, I don't have that great car. They've got the newest phone, I don't have the newest phone. There's so many things and so many conversations that are happening in their heads and in their brains. It's an overwhelming world right now, I feel like, for teens. And preparing for college, those relationships with friends are so tough and so challenging. And not to mention, if they have a boyfriend or a girlfriend, there's just a lot of emotional bombardment right now with young teens. And my heart breaks for them because there's just so much going on. And so when we look at these different types of stressors, the chemical, physical, and emotional, they really can play a toll in how well the nervous system is able to respond and adapt. And so, like I mentioned earlier, things that we do here in the office is we do the insight scan. And the scan is very helpful. It measures different types of parts of our nervous system. And my favorite is that heart rate variability, because it really does show us, is our child stuck in that fight or flight mode or more rest and digest mode. And so what our goal is to get them nice and balanced between the different sides of their nervous system so that their body's able to process and respond to the incoming information. We also measure for inflammation along the spine and along that nervous system and look for those areas where there is increased stress. And those are the ones that we're going to go in and check very carefully for an adjustment. And then also measuring their muscle symmetry at rest and how hard their body is working just to sit still. So I love these scans. We do them on all of the patients in our practice, and it really allows us not only to see kind of where you're at for a baseline, but it really allows us to monitor their progress. What we really want to see is that their nervous systems are settling down. They're less overstimulated. Their body's able to process and respond to that information that's coming in. And so these scans allow us to really monitor that and just show mom and dad, hey, this is what we're seeing with your son or your daughter, and we're seeing some improvements, and we're going to keep working on it until we get nice, balanced scans. And that really gives us something to work towards for parents, because it allows us to monitor and measure that. And so what we want to see is, like I mentioned, that balance in the nervous system. We want to have increased sleep so that they're able to get a good night's quality rest. Their immune response is going to get stronger. That's going to allow their bodies to fight off any incoming infections or illnesses that may be lurking in the schools. They're everywhere right now. It's going to increase communication between the brain and the body. And really what we also see with it is seeing communication more between your son and daughter and yourself. They're able to respond better. They're able to make eye contact and engage with you, which is really helpful to see those connections and those pieces of the relationships getting stronger. And then it improves their ability to respond and make decisions. And I think this is something that a lot of our teens need and a lot of our kids need right now. So I hope that you got some valuable information about how chiropractic care can play such a vital role in your child if they've got those sensory issues, ADHD, anxiety. It's not a quick fix. It is a process of healing for your child's body. I often explain it to parents like we're peeling back the layers, like of an onion, to allow their bodies to express their full potential. And it can make such a difference in the health of your child. So I hope you found it helpful. If you'd love to get your child scanned to see whether or not chiropractic care can help, just give our office a call. We'd be more than happy to check them and do the scans and sit down and talk with you to see what impact it could have in their life. So thank you so much.